Okay, guys, so we'll get started. So, this chapter, chapter 23, is on poverty, homelessness, teenage pregnancy, and a little bit about mental illness. We won't talk about mental illness the way that you already done. I believe you've taken your mental health course already. So, we're not going to talk about the specifics. We're just going to talk about the challenges that they may face pretty briefly. Um, okay, in class. All right, so today's objectives, we're going to talk about the social, political, cultural, and environmental factors that influence poverty. Basically, from a health perspective, how does being in poverty affect people in terms of their health and other social aspects? So we're going to focus in this chapter on four different members of the vulnerable population. Okay, one moment. Okay, so we're going to talk about people who live in poverty, the homeless, pregnant teens, and those who are mentally ill, and what kind of complex nursing needs that they have. It's important for us to understand our own beliefs when we're interacting with these groups beforehand, right? So before we start interacting with them, we need to address our own biases and what we think about these groups. Because the way we think about them affects the way that we treat them. All right, in order for us to interact with them effectively, we need to identify what their healthcare needs are. We need to be able to identify what those barriers are to healthcare and what kind of healthcare services that they're going to need that are unique to each group. So, our attitudes, beliefs, and the way the media communicates to us affects what we think about people, right? So, our perspective, how we think about people, can be affected in that way. So, for example, media. In the media, they show different groups of people in different kinds of ways, right? And even though we don't really think about it, it could affect the way that we think about certain groups of people, especially if we have very limited interaction with them in real life. So we really need to pay close attention to that. And that's why you see in recent times, people have called out to the media to be responsible with the way that they portray people, whether it be people from a racial or ethnic minority group, whether it be people with disabilities, whether it be people with mental illness. It's important that the way that they're portrayed in the media is accurate because, again, if that's the only interaction that you have with a specific group of people, when you finally do interact with them in person, the beliefs that you hold impede the way that you treat them. So let's talk about poverty, the definition, and what it is exactly. So the federal income poverty guidelines, the way that it's defined, poverty, again, that number comes up, $24,300 for a family of four, right? So that's kind of how we define poverty in terms of the federal income. We use this to determine eligibility for public programs. This is for stuff like temporary assistance to needy families, right? So that includes food stamps and cash assistance. That's your WIC, right? We talked about that last class. And that's also a program called Head Start. Head Start is like a educational type program that gives kids from the ages of 0 to 5 pretty much what it says, a head start in terms of learning, right? So they do assessments, they do teaching, just to make sure that by the time the child is enrolled in school, that they're not behind and they're ready to go. Persistent poverty. This is a type of poverty where people remain poor for long periods of time, and then it's even passed on to their descendants. So this is something kind of like generational poverty, where you'll see in the lines of families, it's kind of like it's passed down from generation to generation. Then you have what's called neighborhood poverty. This is basically a geographic type of poverty, meaning that where you live is kind of a poverty stricken area. Not necessarily that you're in poverty, which you may be, but more so that where you're living is a poverty stricken area. And then I have these two here again. And then there's crisis poverty. So crisis poverty is kind of episodic, right? So that's kind of when they go back and forth between being homeless and actually having a place where they live, having a stable home. So they kind of go back and forth between the two. So some factors that affect the growing number of people who live in poverty. Decreased earnings, increased unemployment rates. We hear a lot about that now um, during COVID. Changes in the labor force, right? Before we used to be kind of industrial, and we've kind of moved away from that as we outsource a lot of our jobs. A lot of the types of work that we used to do is outdated, and now can be done, with the use of a computer or some sort of AI, artificial intelligence. Sometimes it's due to the fact that they may have inadequate education and lack of job skills, right? So they're not marketable in the job market. So how does this affect people, right? So people who live in poverty, they tend to have higher rates of chronic illness. So that's your diabetes, your hypertension. We know that stress has a lot to do with the development of chronic illnesses, right? And think about the kind of stress that people are under when they're living in poverty. It can also result in higher infant morbidity and mortality rates. People in poverty typically have shorter life expectancies. They have more complex health problems. They may have more significant complications to their chronic illnesses, right? And they're hospitalized at a rate of 3 times more than those of people who actually have a higher income. Poverty especially has a negative effect on these groups, right? So women of childbearing age, adolescent women, children, older adults, right? Our elderly people, and in both urban and rural communities. So women of childbearing age, adolescent women, children, and older adults, it's pretty much harder for these groups to break out of poverty because of the barriers that are unique to each of these groups, right? Older adults, they're retired, they may not be working, they're no longer in the job market. Obviously, children cannot work, adolescent women as well. And then women of childbearing age, they face their own unique set of challenges as well related to gender. So we know that poverty can then lead to homelessness, right? Homelessness is defined by the Stuart B. McKinney Homeless Assistance Act of 1994 as a person who does not have a fixed, regular, or adequate nighttime residence. So basically, at nighttime, they have nowhere to go. And their primary night residence is either a shelter, some sort of institute like a jail, prison, or mental health facility. So they're basically institutionalized, or they're sleeping in a place that's not designed for regular sleeping accommodations. So this is where you'll see people sleeping under a bridge or in a park or at a bus stop. So those are the two things that define homelessness. They don't have a regular place to sleep, and where they do sleep is either going to be shelter, some sort of institute, or it's going to be outside somewhere that's not equipped for sleeping. The way that we determine the number of people who are homeless are by two different ways. They're both not very accurate, but it's the best that we have. You can either do a point in time count, where basically on any given night, you would go out and you would just count people in the community to see how many people are actually sleeping on the street. Or you can do a count over a period of time. So maybe it depends on, maybe if you're doing a study, maybe you might want to see how many homeless people there are over a course of days, weeks, months, years, whatever it may be. But again, because of the unique situation of homeless people, it's pretty hard to get an accurate count because there's no way to actually be in contact with them. Like how we do the census every 10 years, that's more accurate than trying to count homeless people. So some effects of homelessness on people's health. So these are the things that are unique to homeless people. Because of the fact that they're outside, they're at the mercy of the weather, right? So if it's hot outside or if it's cold outside, They can be exposed to hypothermia or any kind of heat-related illnesses like heat stroke. They can have infestations and poor skin integrity, right? Because they're outside, they don't have access to clean water, to take a shower to get the dirt and germs off of their skin. And of course, that can end up causing some sort of infection. They're at risk for peripheral vascular disease and hypertension, right? Again, the stress. Their diet is not going to be that great because they're eating whatever it is that they can, whether, if they get a couple of dollars and they can go to eat at McDonald's, it's something, but again, it's not the best diet. They can have diabetes and nutritional deficits, again, related to diet. They're at risk for respiratory infection, COPD. A lot of times we'll find that sometimes they're smokers. So that poses another risk as well. Because of the way that they may live, if they're living in, let's say they're squatting in maybe an abandoned building or apartment or something like that, they're living in close quarters with other people, they can be at risk for TB. They can be at risk for HIV and AIDS because of lack of contraception in terms of like barrier contraception, or even if they're drug users and they're sharing needles, then that poses another risk to them as well. It can be at risk for trauma, even physical trauma amongst themselves if they're getting into any kind of physical fight, or even from people who are not homeless. I know you guys have seen on the news sometimes where homeless people end up getting beat up. They'll be victims of violence from people, just random acts of violence. A lot of times they are stricken with some sort of mental illness, and that complicates the case of them being homeless. And also, again, like we said, they may be using tobacco, alcohol, and other illicit drugs. All right, so that's it for poverty and homelessness. Anybody have any questions on that? Okay. And for those of you who, yeah, it is. And for those of you who have, I know one group has poverty and one group has homelessness. Um, these will be good resources for you to include in your presentation. So now we're going to move on to teenage pregnancy. So first we'll talk about some of the trends in adolescent sexual behavior and pregnancy. So compared to previous times, teens are making better decisions about sex, and that has a lot to do with education, right? But unfortunately, a lot of the resources that we have to support teenagers are decreasing, right? We do have reproductive healthcare services available to teens, which is good. But if a teen does end up becoming pregnant, we don't really have a lot of resources for them, unfortunately. Female teens in the US have higher rates of pregnancy when you compare them to other parts of the world. And when you look at racial and ethnic minority groups, they have higher rates compared to their non-minority peers. One of the reasons why teens succumb to pregnancy is because sometimes they feel like they're invincible, right? Even though they did receive the education, they know what can happen, they just feel like it's not going to happen to them. And then there are people, even though they're being educated, there are some teens who still believe certain myths about birth control. Sometimes they'll say that you can't get pregnant on the first time, or, if you pull out, then, you can't get pregnant, those kinds of things. And then that's how they end up getting pregnant. So some factors that can influence teen pregnancy, the family structure and parental behavior can be one aspect. In today's society, both parents often have to work, and older children, like in middle school and high school, are left alone, and we know what can happen if they do not have adult supervision. Also, there is the factor of sexual victimization as well, and that can happen. A lot of times that happens within the family. A lot of times we're protective of our children, and we think that it'll be a stranger who will be the person to assault them in that way. But we also have to be careful within our own families as well. And then for teenagers who do become pregnant, a lot of times what happens is that they get caught in a cycle of poverty, right? Because of their age, they're not working, they don't have the the knowledge, they lack the discipline that they need in order, to get out of that. They're basically at a disadvantage. When it comes to young men and paternity, there's not a lot of data out there, right? Sometimes they may not know that the girlfriend is pregnant, or they don't know the outcome of the pregnancy. Maybe they just may decide to walk away and not to be a part of that. And it becomes even more complex when we talk about the legal stuff when it comes to paternity for minor fathers. And a lot of that stuff varies from state to state. Birth does not emancipate the minor. I'm talking about the female now, the one who's pregnant. So that doesn't emancipate her from her parents. And that also does not emancipate the father from the parents, from their parents as well. What's unique is that the mother can give consent for medical decisions for her baby, but her parents are still responsible to give consent for her medical treatment. So it gets a little technical with that kind of stuff. So be sure to know the law depending on where it is that you're living. But a minor can receive treatment without parental consent for some things, right? So if they're sexually active and they get a STI, they can receive treatment. They can get information about contraception as long as it's not something that requires a procedure like an IUD or something like that. They can get substance abuse counseling and treatment, and they can also get outpatient mental health treatment and emotional crisis services as well. It's also important for us as nurses to be able to identify pregnant teens early, right? Who can tell me why that is? Why do you think it's important for us to do that? And this is just, if you think about it, it's the reason why we need to identify pregnant women as early as possible also.
I mean, because to get prenatal care as soon as possible.
Yes, they need prenatal care as soon as possible. And we know that pregnant teens are likely to not get prenatal care, right? Until the very end because they're hiding their pregnancies, they're afraid to tell their parents. So it's important that we identify them as early as possible. They're unique because they're at risk for certain things more so than women who are older. They're at risk for violence from their partner. They're at risk for nutritional deficits, right? Because depending on how young they are, they may still even be developing themselves. So now they're eating, for their development, and they're eating now for the development of their unborn child. Another issue is infant care. After the baby is born, they're going to need somewhere to take the baby to. That's an issue for them, especially if they're going to continue with school and go on with their educational needs. So those are some special issues. Take note of that for pregnant teens that we need to be aware of and try to help to facilitate that. All right, mental illness. So the prevalence of mental health problems in the United States is very high, and anyone at any age can be at risk for a threat to their mental health, right? So it's not more so one group than another. Any time across the lifespan, any of us can be at risk for some sort of mental health factor. So our at-risk populations are children and adolescents, adults with serious mental illness, older adults, low income and minority groups are often at high risk because they lack access to services. Okay, then remember we talked about deinstitutionalization, right, for our first exam. So remember what that is. That's basically when we're moving people from state institutions and we're moving them back into the community, right? The goal of that is to try to improve their quality of life because we've done all we can do for them in the institution. We can't keep people locked up in institutes forever, right? We've done the treatment. We feel like they've gotten to a better place. We move them back into the community, but oftentimes the community is not set up to take care of them. So there's a lack of continuity of care. And then we see that they end up relapsing back into the same problems that they had before. So some levels of prevention to help out these groups, right? So some primary prevention could be affordable housing, housing subsidies, things like Section 8, right, where we give a portion of the money so that they can pay for their rent, and maybe they may need to come up with a small amount, to pay on their end. What else? Needle exchange programs. That's also a primary prevention, right? Although the person they're already addicted to some sort of substance, but the goal with the needle exchange program is to prevent them from getting and transmitting HIV, hepatitis B, hepatitis C, as well as prevent them from getting nasty infections from dirty needles. Because we know, have you guys ever seen any kind of like skin infection where somebody's arm is like completely open just because, they've been using dirty needles? So those are the things that we're trying to prevent. When it comes to secondary, some of these activities are a little different than what we talked about. Yes, there is the screening for depression, right? So we can screen for depression and we can screen for a lot of different things, right? But they've also added here supportive and emergency housing, as well as soup kitchens. So basically the secondary preventions here are aimed at reducing the prevalence of a condition, right? So just keep that in mind. We're still going to do screening for levels of prevention for secondary, but add those two there. And then in tertiary, this is where, again, remember, we're trying to restore and enhance functioning. So for this one, it could be supportive, affordable housing. Remember, we talked about that in primary as well. So sometimes levels of prevention can get a little tricky. Some of them will be primary and tertiary. Keep that in mind. I will try to avoid putting questions like that on the exam because my intention is not to confuse you, but just to remember when you're out there in the real world that those can be considered primary and tertiary as well as psychosocial rehab programs is a tertiary level of prevention. And so the role of the nurse, remember, we're going to talk about this almost every time. We need to make sure that we're creating a trusting environment. We're showing respect, compassion, and concern. We're not making assumptions. We're knowing when to help the client and knowing when to tell them that they need to, do certain things on their own. So just remember that creating a trusting environment and showing respect is particularly important because with vulnerable populations, a lot of the times they receive a lot of judgment. People don't really care for them the way that they should. So as the nurse, it's important for us to try to build that relationship and that rapport with them. Okay. Anybody have any questions on chapter 23? Okay, so now what we're gonna do, we're gonna do a breakout session. I'm gonna actually break you up into your project with your project partners. And the activity that you're gonna do is actually gonna help you with the project. So you can include the work that you've done here today in your presentation. In the community. And you'll see the acronym ATOD. That's alcohol, tobacco, and other drugs. We label it like that because a lot of times when people think about drugs, we're only thinking about the hard stuff, right? And we don't recognize that alcohol is a drug, tobacco is a drug, caffeine is also a drug. So just to make sure that people understand that. So substance abuse is one of the biggest problems in our national health, right? And people who abuse substances, they not only put themselves at risk, but they're putting other people at risk as well, right? If the substance that they're abusing is alcohol and they're getting behind the wheel, that's an example of how they're putting themselves and others at risk. When they drink or when they use other drugs, if that causes them to be violent, then that puts, their family at risk as well, or anybody that they may come into contact with. So having these addictions, abusing these substances can cause multiple health problems for many different people. There are a lot of factors that contribute to this. One of them is a lack of knowledge about the use of drugs. And this is why you'll see in school settings, we'll have like DARE programs and stuff like that, which can be helpful to a certain degree. But a lot of those programs, what we find is they kind of use that just say no approach. which we find is not helpful oftentimes. One, because children have a natural way of being curious. So just telling them to say no and not really telling them why they need to say no and properly educating them can kind of backfire. And another thing is that we kind of underestimate the power of peer pressure. So just telling them to say no doesn't work if they're seeing that their peers are using it and if they're not seeing any kind of bad effects from it up front, then they'll believe that taking these drugs is not so bad and they won't believe when the adults are telling them to just say no. So we need to be honest and open in educating them and making sure that they understand why it is that they need to say no and give them examples. I know depending on the age, you don't want to give them too much information sometimes, but giving them information that is age appropriate and building onto that as they get older. Every culture has their beliefs and attitudes that surround alcohol, tobacco, and other drugs, right? Certain drugs may be seen as good or bad or what may you. So just think about that as well we're going through these slides. Think about how your culture may view these things and how that shapes how you view it. Okay, so we've already defined ATOD, which is alcohol, tobacco, and other drugs. Substance abuse is basically using any substance that is not in the way that it was intended to be used, and it basically kind of threatens the person's health or may impair them. It may impair their judgment, their thinking. It could also impair them socially and their economic function as well. Think about how people function when they're addicted to a substance and how that may affect them getting a job or keeping a job or may affect them their enrollment in school and things like that. And then we have two terms that you may be familiar with: drug dependence and drug addiction. So the difference between the two, drug dependence is basically when a person is physiologically dependent upon that drug, right? And if they stop using it, then they may have withdrawal signs or withdrawal symptoms, which may include like anxiety, fatigue, sweating, vomiting, depression. Could even be as serious as having seizures and hallucinations. It really just depends. Now, drug addiction is when there is a pattern of abuse, right? And when the person is preoccupied with it. That's all that they ever think about. They'll spend their last money, just to get their hands on that substance. So that's the difference between dependence and addiction. And then, of course, alcoholism, we know, is an addiction to alcohol, which we know is also a drug. So we have psychoactive drugs. These are the drugs that can affect our mood, our perception, and the way that we think. People tend to use these drugs in social and recreational settings, right? So like with their friends, at parties or clubs and things like that. And it's pretty much for their own personal enjoyment. It's kind of a way to self-medicate and distract them from any kind of physical or emotional discomfort that they may be having. Sometimes you'll hear people say that they use drugs just as a way to get away from reality. And that's one of the reasons why. Psychoactive drugs are divided into different categories depending on how it affects the central nervous system. So we have depressants, right? These are the drugs that reduce our activity in our CNS, right? So they slow you down. So they basically kind of make you feel sluggish. They decrease your heart rate, they decrease your respiratory rate, they affect your muscular coordination, and they decrease your energy. Now, if you take these kinds of drugs in higher doses, then you know that that can lead to a coma, right? Because of the respiratory depression that occurs. And if you're taking extremely high doses, then your vital functions can also shut down, and that can result in death. And that's why sometimes you'll hear, when people overdose on drugs, essentially, that's what happens. Some of these categories of depressants include alcohol, barbiturates, benzodiazepines, and opioids. Then you have your stimulants. This is the opposite effect of a depressant, right? It increases the activity of the central nervous system and it causes wakefulness. A lot of times people will take these things to try to help them stay awake, especially if they're working a lot and they're not getting enough sleep. What these things do, they don't necessarily give you more energy, but it basically kind of helps the body expend its energy sooner, right? So it's giving you that what's the word I'm looking for? The misconception, I guess, that it's giving you energy, but really what it's doing is just causing you to use up the energy that you have inside of you already pretty quickly. And then that's why you get that crashing sensation once it starts to wear off. So this is like your caffeine, your nicotine from cigarettes, cocaine, and amphetamines. They have that effect on the body. Alcohol. Alcohol is the oldest and most widely used psychoactive drug in the world. About 2/3 of American adults drink alcohol. Binge drinking is one category of drinking, right? We know this as heavy episodic drinking, meaning that you typically don't drink, but like when you get in a social setting, you may start drinking very heavily. Usually the intention is to get drunk or messed up. What population, what group do you think tends to indulge in binge drinking?
Teenagers?
Mm-hmm. Right. So your high school and your college students, those are the ones who are typically going to be indulging in binge drinking. And again, usually the intent is to get messed up and wild. So chronic alcohol abuse. This is when someone is consistently drinking alcohol. They can't a day can't go by where they don't have multiple drinks, right? Not even just one drink, multiple drinks. So some health implications of chronic alcohol abuse, they are many. They affect pretty much all of your systems. So the first one, it can cause nutritional deficiencies. So when we do labs, it's not unusual to see that they have low folate, low iron, and low niacin, right? They may have GI disturbances, so they can have an inflammation of the esophagus and stomach because we know that alcohol is a harsh substance. It's very caustic. So if that's something that they're drinking multiple times a day, that can eat away at the lining of the esophagus and the stomach. And we know that that can result in cancer, right? Can also result in liver cirrhosis and liver cancer. And there is also something called alcohol-induced pancreatitis, where there's inflammation of the pancreas because of the abuse of alcohol. So if you ever have a patient that comes in and they have pancreatitis, one of the things you want to ask them is about their alcohol habits. So cardiovascular symptoms that they can have or implications they can have, it can have cardiac dysrhythmias, hypertension, and atherosclerosis, right? Which we know is the hardening of the blood vessels. Okay, the CNS, the central nervous system, it can cause depression, sleep disturbances, memory loss, and organic brain syndrome, which is basically kind of like the deterioration of the brain. Something that you would normally see maybe in someone who has maybe like Alzheimer's or dementia, but in a person who is not at that stage yet. So they're having like memory loss, confusion, and anxiety. In the neuromuscular system, they could have myopathy, which is a dysfunction of the muscle fibers. What you'll normally see there is weakness and fatigue. They can also have peripheral neuropathy, which is damage to the nerves in the extremities. You usually will see that like with people who have diabetes, right? They may have like that tingling or kind of a, what's the word I'm looking for? There's another word, I can't think of it, but that tingling sensation in the extremities. In men, they may have decreased sex drive. They can have enlarged breasts, also known as gynecomastia, and shrinking of the testes. And then in women, what we're concerned about is if they are of childbearing age. If they are pregnant, then that can result in fetal alcohol syndrome of the infant. This is characterized by facial features that have like small eye openings, a thin upper lip, and a smooth philtrum, which is the groove between the nose and the upper lip. So it looks like this here. Normally there's like a little groove right here in the lip. Here it's flat, okay? You can see the ear abnormalities there, low nasal bridge, and so on. Now, tobacco. So, tobacco we know is a huge problem in the United States. Smoking is one of those things that is very preventable. It's a preventable cause of death. It causes cardiovascular diseases as well as we know respiratory diseases. Nicotine can act as both a suppressant and a depressant and a stimulant, right? So it can have both effects. It can depress the CNS system, but it can also stimulate it as well. So then we know we have mainstream smoke, which is inhaled directly by the smoker. Then we have side stream smoke. We call it secondhand smoke in the media, right? That's when people around you are inhaling that smoke, right? Then we have something that is also called third hand smoke. Does anybody know uh, what that constitutes of? Third hand smoke.
First time I hear it. Nope.
So third hand smoke is like when you walk into someone's house or you go into their car and you know they're a smoker because that smoke is trapped in the fibers of like the couch, the curtain, the car seat, the carpet. And inhaling that is still bad for you too. Even though you're not inhaling the mainstream smoke or the side stream smoke, it can still have a bad effect. Hmm. And then we have fourth hand smoke, which is something that I learned about this year. And fourth hand smoke is when you're in the presence of someone who was in the presence of a smoker. So, yeah. Hmm. So, when I heard of this, it made me think back in middle school. There was a girl who would always come to class and her book bag smelled like smoke. Um, and her mom was a smoker. So even though she didn't smoke, her clothing and her bag was like penetrated with that smoke, the smoky smell. And when she came to school, it smelled like she was actually smoking, but it wasn't her. So that's an example of fourth hand smoke.
That's also why I hate tobacco smoke. Like, it just stays on everything, on you, your clothes, your hair, your car. Like, it's
Mhm.
a hard smell to get out.
Yeah, and if you're the smoker, it's on your fingers.
Mm.
It's on everything. Mhm. Mhm. Yeah. So yeah, and we're concerned about it because why? Particularly in kids, right? We know that they're susceptible to smoke, especially if they have asthma or anything like that. And we know that secondhand smoke is also SIDS is attributable to that. So as well as like respiratory and ear infections as well. So we have to be mindful of that. All right, so caffeine. This is another widely used psychoactive drug in the world. Pretty much every culture drinks coffee, right, in one way or another. We can find caffeine also in tea, in certain soft drinks, and in some medications as well. So a moderate dose is 100 to 300 milligrams per day. So that works out to about 1 to maybe 3 cups of coffee, not very large cups, but small cups of coffee. High doses can lead to physical dependence, right? We know those people who just cannot start their day without a cup of coffee. And if they do try to go without coffee for even like a day or so, then they start to get withdrawal symptoms. And that's how you know that it's a drug. They can get headaches, they start feeling slow, and they can even develop depression as a result. So now let's talk about illicit drugs, right? So heroin. Heroin is the most recreationally used opioid in the US. I think maybe worldwide also. Tolerance and physical dependence develops quickly. So this is a drug that people get addicted to very quickly. It can have some very serious complications related to overdose, but as well as because of the route that it's taken, its injection, we know that people can get very bad infections from the use of used needles or reusing needles, right? So like I mentioned before, you can get very bad skin infections, but then we're also concerned if they are mixing needles between people, then there's the risk of transferring HIV as well as hepatitis C. Then there is cocaine. We know that people can inject or smoke this. It causes hyperstimulation, alertness, and euphoria. Euphoria is like a good feeling, right? They just feel very good. And a lot of times people will say that it makes them feel very competent and makes them feel like they are in power. Crack is a derivative of cocaine, right? It's made from cocaine and it sells cheaper, but addiction develops very quickly and it becomes an expensive habit. Amphetamines, they are similar to cocaine, but the effects last longer and the drug is cheaper. People will typically use them because they want to decrease their fatigue. They want to feel more alert. Sometimes they use it to suppress their appetite. And they also say that it makes them feel good. We do know that there are legal forms of amphetamines that have to be given by prescription. A lot of times people with ADHD use these drugs. That's your Adderall, your Concerta, your Focalin. There's also drugs that are made specifically for weight loss as well. Can't remember the name of that one drug that everyone uses.
Adipex.
Is there another name for it? There's like another name that
Phentermine.
Yes, phentermine. Thank you. Yes. That's a weight loss drug that you can get by prescription only. You do have to have an annual physical. You have to do an EKG to make sure that your heart rhythm is right. But people do use those recreationally as well to try to. So it's important to recognize that if you're using it under the scope of a doctor and you're being monitored, that's okay within reason. But to be using these drugs and not getting the follow-up that you need can be very dangerous. Because as I said, you have to get a EKG to get it because these drugs can interfere with your heart rhythm. Marijuana. So marijuana is the most widely illicit drug that's used in the United States. There is some psychological dependence that can occur with chronic use, but there's not a lot known about any potential physical dependence. And because of the status, right now it's confusing. It's legal, it's illegal, we're not sure, if you get caught with it, what's gonna happen, if you get a drug test for your job, even though it's legal in your state, maybe the job won't consider you because they may consider it something illicit. So these are the things that you have to consider, particularly with marijuana. And another thing is that there is really, although there are moves being made for quality control, there still is little quality control. It varies, right? So you need to be certain, users need to be certain whether or not they are consuming marijuana that may be contaminated with other products. Then we have hallucinogens. All right, these are the drugs that stimulate the nervous system and they can alter your perception and impair your judgment. So they can make you see and feel things that aren't actually there. And that can be very dangerous, right? The response to this drug varies by from different people, how they may respond to it. But there is that risk for injury because if you're seeing things and feeling things that aren't really there, it can cause you to do things that can be dangerous. You could run out into traffic, you could jump off of a building. Like it sounds really out there, but you hear these very real stories of people getting hurt because their reality is distorted as a result of these drugs. Examples of these are MDMA, which is also known as ecstasy, and LSD. LSD is known as a very dangerous hallucinogen that has actually caused people to do a lot of crazy things that resulted in their death. And then we have inhalants. Inhalants are basically, can be anything, any kind of common household item that people can find, things that are like in spray cans. Basically what they do is they inhale it either from the can, or they can soak cloths and then inhale it that way. They can, or do what they call huffing. A lot of times this is the first drug that young children use because it's easily accessible, right? Everybody has like a can of like air freshener or something in their house that kids can get their hands on. It is a short acting type of drug, and it has a very rapid onset. Depending on how much they take in, they feel a slight stimulation, and they can even lose consciousness. It's very seems very simple, but it can be very dangerous. And there is a link between school performance and the use of inhalants, because like I said, a lot of times this is something that kids will do, especially because it's so easy for them to get their hands on. So some primary preventions, right? So what we want to do in terms of alcohol, tobacco, and other drugs, we want to first promote healthy lifestyles and resiliency factors, right? So we want to teach and educate people on, how to be assertive, how to make good decision making skills, just because, again, the just say no approach doesn't work. All right, just telling kids to not do it, we show that it just doesn't work. So we need to educate them on how to be assertive and how to say no and how to make good decisions based on the education that we're going to give them. We also want to teach stress reduction and relaxation techniques, because again, a lot of times people will say that they start using drugs and that they continue to use drugs because they want to get a relief. They want to get away from reality. So we want to teach them ways to do that without endangering themselves. Secondary prevention is you're going to be your assessment and your screenings, right? So early detection in schools, in the workplace, and make sure that we're targeting our high risk groups, right? So our adolescents, of course, because we know that people are being introduced to this at a young age. We want to target pregnant women to test them because of the fact of the bad outcomes that could occur if they are using drugs while they're pregnant. And injection drug users, we want to screen them as well. And like if we can, go ahead and introduce them to like the needle exchange programs to make sure that they don't get something else in addition to having a drug problem. And then finally, we have our tertiary prevention, right? So this is our detox, our rehab, addiction treatment, smoking cessation programs, support groups. So these are like your AA, your Alcoholics Anonymous, your Narcotics Anonymous. And then they even talk about Overeaters Anonymous and Gamblers Anonymous, because those are also issues that can go along with having a drug addiction. A lot of times when people have an addiction, they'll try to get over it, and they do, and then they replace it with something else, right? So they replace that drug with eating or gambling or shopping, and then they develop another addiction. So these are just all resources to give them that may be helpful for them on their journey. And then our role as the nurse is basically to have knowledge of community resources and how to get them to patients. We need to be able to develop community prevention programs, and we just need to be there to assist them in any kind of tertiary prevention that we're doing, whether it be a support group or rehab or detox or what have you. So that's why I have you do those class assignments, just having you look up resources and coming up with some sort of program. Because if you do decide to work as a community health nurse, these are the kind of issues that you're going to face. Okay, anybody have any questions? All right. So now we're going to move on. What time is it? All right, it's 8 o'clock. We have time for the last chapter. And then by the time I'm finished, it should be time for our dinner break. All right, so chapter 25 is on violence and human abuse. So just to start off, we're going to go over some definitions. So violence is basically any intentional act to cause harm to another person. Okay, we know that there is a lot of death and disease or injury that results from violence, right? If the person doesn't necessarily die from violence, they may, if, for example, if they're the victim of like a shooting, right? We know that they can face long-term effects from that, whether it be brain trauma, spinal cord injury, what have you. Oftentimes, nurses were responsible for the care of the victims, but also for the care of the perpetrators, the people who, did the attack, right? So we need to be aware of that and just to make sure that we understand that we still need to provide quality care, whether or not we are giving care to the victim or, to the attacker. So over the next few slides, we're going to talk about social and community factors that influence violence. This is work, education, the media, organized religion, population, and community facilities. So we know that, most adults work and work can be fulfilling, and it helps us to be able to contribute to our household and provide a sense of well-being, right? But it can also be frustrating. It can be unfulfilling if you're in a role that you don't particularly like. And it can contribute to stress in the home that can lead to aggression and violence. So an example of that is maybe a parent coming home from a long day at work. Their child is playing loudly, and then the parent might smack the child out of frustration, right? So we need to realize, workers may have difficulty separating feelings that they have at work, and then they come home, and then they're in a situation that's unpleasant, and then they take it out on their family. So this is one factor that can contribute to violence, at least in a home setting. And then on the other side, if the person is not working, if they're unemployed, that's also another stressful situation that could result in a parent lashing out, at their child or another family member. All right. Another thing is education. Your textbook talks about spanking in the school setting. In 2020, that's not something that we particularly see in schools, but that is something that can happen in the home. So, does it work? Some people say that it does. Some people say that it does not. It is a cultural thing. And one thing we do have to be mindful of is to make sure, any kind of physical discipline to make sure that it doesn't become something that is child abuse, right? Because there is that line between, some sort of, just spanking your child and then physical abuse. What I will tell you that is that the research shows that spanking is not recommended just because as a form of discipline, it can reinforce violent tendencies. So if you're hitting your child to tell them not to do something, they can internalize that as this is how we behave when somebody does something that I don't like. So just to keep that in mind. Then there is bullying, right? Which is the use of physical attack or even intimidation. In today's modern world, we also have cyberbullying, which occurs online, either via social media or text messaging. And that's something that nurses need to be aware of in terms of educating kids about and also their parents. Bullying is associated with depression and anxiety and also suicide, as we have seen in the news quite a lot. School can be a powerful contributor to nonviolence. So it helps when anti-bullying policies are in effect and are actually enforced. Sometimes you'll hear them say like, oh, we have a 0% policy or whatever it is, but then it's not actually being enforced. So then it really doesn't do anything. Another thing that we need to do in schools is to improve student supervision, because we know when kids are unsupervised, that's when issues arise as well. And finally, we need to involve parents in a lot of these school initiatives as well, so that they can talk to their kids not only about what to do if they're being bullied, but also to talk to their kids about not being the ones who are doing the bullying. Okay, so the media. So the use of TV programs and even written articles can inform and increase public awareness about violence, and in particular, family violence, right? So for example, sometimes you'll watch a television show that talks about a very, sensitive topic, whether it be about domestic violence or some sort of sexual assault. A lot of times victims in real life can benefit from this, because when things get media attention, it helps to lessen the stigma. A lot of times they'll even point to a resource that people can call out to if they do need help with that. And then there is the thought that media can indirectly lead people to choose violence via the route of watching violent movies or even playing violent video games. There is a lot of debate about that, especially when it comes to younger children watching these things and playing these things. Some people are divided and they say, no, that doesn't cause people to be violent. And other people will say that, yes, it does. I will say that studies have shown that media can cause people to behave violently. I don't know if I agree with that 100%. I don't think that there is an absolute with that. What do you guys think? Hmm.
I think it, I, I think it's like the professor said that there's not an absolute about it, but there's definitely more than one factor that attributes to that, because if essentially children mimic what they see, and then they become older adults, and that's what they think is normal. So if all they see is violence, like you said, Steph, that's what they're gonna mimic.
True, I see what you're saying. Mhm. Yeah. Yeah, it's definitely multifactorial. It's not just, um, I think sometimes the studies don't take that into consideration. You may be looking at, yes, they have viewed violent media or they have played violent video games, but what were the other factors that contributed to that? What are some confounding factors, I believe is what it's called, where it's like, this happened to this person, but it didn't happen to that person. So we have to take those things into account as well. While I do think it is important that we do shelter our children to a certain degree from certain things that they see in the media, but I think about some of the things that I've seen growing up and the video games that I played and play still, and I don't wouldn't consider myself to be, a violent person. So.
Professor, since you know that, since you said the thing about the parents, sometimes it also comes down to like the parents. I mean, we see it on like movies and TV shows or whatever, where the kid knows that he did something wrong and he goes to the parent for help, and the parent is the one that's trying to cover up what the kid did because the parent is trying to overprotect their child. So sometimes it's not even the child, sometimes it's actually like the parent.
Mm-hmm. Yeah, the parent not allowing the child to, kind of just face the music and face whatever punishment comes if they did happen to do something bad. Yeah. Another factor can be organized religion, right? So we know that religion generally teaches about nonviolent conflict resolution, right? But historically, there is some contradiction, right, between abuse and a religion. So we know the saying from the Bible, if you spare the rod, you spoil the child, right? But it doesn't really provide you with any kind of parameters. What does that mean exactly? How much are you? Mhm, mhm. Oh, wow. Mhm. Yeah, fine. And it's like, where do you draw the line? How far is too far, because it doesn't that statement can mean anything to anyone, right? In your case, the nun was taking rulers and hitting kids for putting their hands on the desk. So, we have to be careful again where we draw that line between discipline and abuse. And then another issue is the victimization of women, right? Where they're kind of forced to stay in these marriages. And not only women, we know that men do get abused as well. But people are forced to stay in marriages because, some religions are very, anti-divorce, regardless of what the situation is. So that's another factor that can contribute to the perpetuation of ongoing violence. Another factor is the population, the community that we live in, that can influence potential for violence. We know that neighborhoods that are poorer and more crowded, that creates an opportunity for tension and violence to rise. That's why we'll see where in communities where geographically there's a lot of poverty, you'll find that there is a lot of crime that happens there. One of the issues is there's a lack of jobs or there are low paying jobs, and that can lead to people in the community feeling inadequate. They can feel despair. They just kind of feel hopeless, and feel kind of alienated socially from other members of the community. Other times you'll see where people may be involved in gang activity, right? Where joining a gang, they may see that as the only way for them to make money and to survive. They may even join as a means of protection from, you know, another gang or another rival gang in another community. So sometimes we see these things and we don't understand, well, why, you know, why does this neighborhood act like this, or what's going on here? And then what we don't understand is that, again, when you have a lot of poverty, you have crowded conditions, these are the things that contribute to tension and violence in the community. And then finally, community facilities, right? What kind of resources and facilities are available to the residents in the community? And this kind of goes back to what we were talking about before. Um, Having these things that I have listed here, you know, playgrounds, parks, swimming pools, movie theaters, tennis courts, those things are really great and they can help to reduce potential crime and violence, right? Because we know if we keep, especially our younger population, busy, you know, with things to do after school, we can help to keep them away from that kind of a life. But at the same time, we don't want to assume that putting these things in a community is just going to automatically erase crime and poverty and all of that. We still need to address the root of the problem, which starts with socioeconomics, the lack of income and other opportunities that people are missing out on. All right, so some more definitions for you. So homicide, this is the killing of one human being by another. Assault is a violent physical attack or verbal attack. Sexual violence is basically forcing a person to take part in a sexual act when there has not been any consent given, right? Or we consider this rape as well. Roxy Bolton Rape Treatment Center at Jackson Memorial Hospital is the treatment center that we have here in Dade County. Nurses, I just point that out to you just because that's where they go if they have been assaulted and they consent to having, what is it, a rape kit or being examined, then they can have that on file if ever they choose to, you know, move forward in terms of pressing charges if they know who the person was that attacked them. As a nurse, when we're treating victims of sexual assault, we need to be non-judgmental and treat the victim with respect and assure privacy and confidentiality. So, you know, when you're taking the your assessment and you're doing your intake, right? Sometimes you'll hear stories, you know, where maybe they were put in, you may consider that they've put themselves in a compromising position. But again, we don't want to be judgmental. So regardless of how it happened, where it happened, we just want to make sure that we're treating them with respect and providing them with that privacy. And then also, if they choose not to be examined, to remember that they have the choice not to do so. We just want to, you know, gently remind them the reason why we're asking them to do it, so that they know that they have a choice, but to understand that they have the right to refuse.
I have a question on that. For the rape kit, how long before it doesn't count? Like how many hours have to go by? Because I don't know why I heard like 24 hours after that it doesn't really count.
Yeah, I don't know how much time has to pass, but I know one of the important things is for them not to shower, not to clean up or do anything like that. I would have to check on the time, but as soon as possible is best because that's when everything is going to be fresh in terms of her recall of what happened, as well as collecting, you know, any kind of specimens, taking pictures, if she has any bruising and things like that.
Yeah, because I know of in the past I had a situation, not me, but someone I knew had a situation like that. And, you know, by the time that they went to the hospital, it was over 24 hours, maybe like the next day or so. And they had told her that they couldn't do the rape kit on her because she had already showered. So if they showered, they can't do it?
I think, to my knowledge, I think they can still do it if they showered, and even if the time has passed, but you just want to document that. I don't think that, you know, they should have turned her away. I mean,
Yeah,
obviously,
that's why I'm like,
if
I
it's,
have to ask because that's crazy. I
yeah,
mean,
I
even
mean,
if they shower, I think they should have still taken the culture of whatever, you know,
mhm,
they had to do.
yeah. And I mean, so as a minor, I don't know legally because I haven't read this legally, but I had a case. I wasn't there personally, but my preceptor did when I was at Jackson. And there was a minor who came in and she said that she had been sexually assaulted and the mom wanted her to have the rape kit done, but the minor said she did not want to have the rape kit done. So it's up to the minor because she has to consent, even though the parent is responsible for her, she has to consent to her body in that respect, right? So it gets a little tricky there. And sometimes parents will try to pressure you into doing things that you're not supposed to do. But we have to remember that even though she's a minor, it's still her body. She has to give consent to that. I think, does that answer your question? Is that what you're asking me?
Yeah, because this person, it was a minor at the time, and I found it weird that they wouldn't, you know, take more, like look more into it and just like kind of brushed it off, you know?
Yeah, and
So I just
sometimes
had
that
to ask
comes
that.
with the whole what I was saying about being judgmental. Sometimes they may look at the young girl and think that, oh, she was probably just partying or she was doing, you know, something where they would say like she caused it, you know, on herself.
Right.
And we need to make sure that we get away from that kind of attitude, regardless of if she was drunk, she was taking drugs, whatever the case may have been. I'm not saying that was the case, but we need to take
Right.
every instance seriously. Do the rape kit, do your documentation, and, you know, let it go from there.
Okay. Thank you.
You're welcome. And they also offer, when you guys become RNs, if you ever want to specialize in that, they offer courses where you can get like a certificate to become like a forensic type nurse where you do those kinds of exams. A sexual assault nurse examiner, I believe is what it's called.
Oh, okay. That's cool.
Yeah, actually I saw that in one of the hospitals that I went to clinicals too.
Hmm.
They had like it's kind of like a continuing education, but specific to how to handle victims of violence or domestic abuse.
Hmm. And then finally, we have the definition for suicide, which we know as the act of when someone takes their own life voluntarily and intentionally. Okay. All right, on this last slide here, we're going to talk about family violence and abuse in terms of physical abuse, sexual abuse, neglect, child abuse, a little bit about intimate partner abuse and abuse of older adults. All right, so when we're doing our assessment and we're looking at individuals, signs of an abuser, maybe things like they have a low tolerance for frustration, right? So maybe like they're always annoyed, like when their kid does something, even the slightest of things. They're emotionally unstable, meaning like one minute they're, you know, happy, another minute they're sad, they're upset, like they're just back and forth. They're not stable with their emotions. And sometimes they can even exhibit aggressive behavior. Okay, so physical abuse we know is, you know, any kind of hitting, slapping, punching. Sexual abuse we know is basically abusing someone or engaging with someone in a sexual contact without their consent. We talked about child abuse before, right? So what are some indicators of child abuse when we see a child? What are some things that'll let us know that they're being abused physically?
Bruises in different stages of healing.
Mm-hmm. Bruises. Mm-hmm. Mm-hmm. Yeah.
Mhm.
Mm-hmm.
Symmetrical burns in their hands.
Yes, right. So like if a kid got burned, right, by accident, we would expect it to look like a splash of some sort. And it would normally be in an area that's typically exposed. But like Stephanie said, if you see burns on like a torso, usually a kid would have like a shirt on that would protect them at least from, that burn. But if you see like a burn where there's like a line where it may look like their hand or leg was dipped into something like hot water, because that does happen, that's suspicious, because a kid typically wouldn't dip their whole hand like, in hot water. Once they feel that on the fingers, they're gonna draw back. So if you see that, then the hand was intentionally dipped. What about indicators of sexual abuse in children? What does that look like? Mm-hmm. Like for
Can I like go both way? Can I like go both ways? Like a child can rebel like sexually, maybe because of the abuse.
Yeah, they can have like inappropriate sexual
Right, like inappropriate behaviors.
yeah, it's
That's
like
what I was trying to get
incongruent with their age, right? So like if you have a 5-year-old that just kind of has a little bit too much knowledge about certain things, you have some kids that are educated and a little precocious and they know what's going on. But if their knowledge and behavior is incongruent with how old they are, then that's a problem. If they're touching people in certain places, that could be a sign that people are touching them in certain places and they don't understand that that's incorrect behavior. If they have difficulty walking or sitting down, that could be an indicator. What else? If they're presenting with STDs, right? If you have a 6-year-old coming in with an STD, that's an indicator that they're being sexually abused. Or if there is even pregnancy, you have girls who have periods as young 7, 8, 9. If there's a pregnancy that's going on, then that could be a sign of sexual abuse, because it would be very unlikely, even if they were engaging in sexual activity with someone their age. When girls develop, sometimes we know they can develop faster in terms of having a period. Males typically don't have like, ejaculations and stuff like that until, they're much older. So that would be a sign that that was somebody who is much, much older than them abusing them. What about neglect? What does neglect look like? Mm-hmm. Mm-hmm. So they're basically not getting the things that they need. So they're not being physically abused, even though people can physically abuse and neglect someone. But if it's just neglect alone, then what that looks like is just they're not getting what they need. Food, water, clothing, love, basic nurturing, they're not getting it. So that's the difference between the abuse and neglect. All right, let's talk about intimate partner abuse a little bit. So some of the signs, of course, bruises, broken bones, lacerations. A lot of times the victim will try to minimize the abuse and blame themselves. They'll try to do things differently in order to try not to anger their partner. And eventually they realize that it doesn't really matter what they do. Their attacker just finds a reason to be angry, so that they can have an excuse to abuse them. A lot of times victims, they'll stay due to fear, right? They think that, if they try to leave, they may try to harm them or kill them. They might stay because of financial reasons. Maybe their partner is the breadwinner, and they rely on them for finances. And again, like we talked about, they could be staying for religious reasons as well. Our part as the nurse is to support the victim, and not to try to force them to take any steps that they're not ready to take. So like the group was talking about before, that had the intimate partner violence population, basically what you want to do is just prepare them on how they can safely leave when they are ready to finally take that step, right? So, you know, putting aside money if they have access to their money and they're not being financially abused as well, putting aside money, packing a bag and hiding it somewhere where their partner won't see, collaborating with family and friends that are supportive to help them execute that plan, whether it be someone coming to pick them up or giving them a place to stay or helping them find a shelter or whatever it may be. But just having a plan in place, because if there's not a plan in place, you know, and they slip up, then that could be something that can cause them to one of the most dangerous times in an abusive relationship for a woman is when they try to leave. And if the partner finds out that they try to leave, that could result in them, you know, being abused very badly or even in their death. So
And that's why a lot of people don't understand. They're like, oh, why don't you just leave? You know, and you know, it's not that easy for a person to leave because they're scared.
Mhm. And then finally, let's talk about abuse of older adults. So we know what physical abuse looks like. So the same things that we would see in children and women and even men with abuse physically is what we would see in older adults, the broken bones, the bruises, and what have you. The thing with adults is that abuse is not only physical, it can be financial, right? And a lot of times it's the family members that are, you know, taking their money because they're older, maybe they're being forgetful and they don't remember what's going on. So they have someone taking care of their finances for them and they're taking money out on the side. Maybe they are if they're the caregiver, maybe they're not taking care of them the way they're supposed to be. Maybe they're not giving them their medications when they're supposed to be giving them, or they're not feeding them according to their dietary restrictions. Maybe they may have unrealistic toileting demands, right? So, you know, when people get older, they may need to go to the bathroom more often so that they don't have any kind of accidents on themselves. And maybe they, you know, the person who's taking care of them is tired of taking them back and forth to the bathroom. So they're having them hold it or forcing them to wear like Depends and stuff like that, even though they don't necessarily need it. Not honoring the way that they want to live. So again, if they have a caregiver that comes in and is taking care of them, they're just not being respectful of the way that the person wants to live and is just taking advantage of that. And finally, another example of abuse in older adults is giving them medications, right, to make them drowsy. Similar to what you'll hear sometimes people will do with babies or younger children, like they'll give them like a Benadryl or something like that to make them go to sleep because they're being troublesome, and they just don't want to deal with that. That's another form of abuse as well. So even if they have like a Ativan or something in the home that the doctor has for them to take PRN as needed, if you're giving it to them in a way that is not prescribed, that's not the instructions on how they're supposed to get it, that can be considered abuse. Because if you're just giving it to them because you know, you're tired of dealing, you know, with them getting up and walking around if they're forgetful. Uh, Again, that's a form of abuse as well. All right, nursing interventions that we can take. So as a nurse, it's again, we're like kind of like the first line here. So if we see something, we need to investigate it further and make sure that we report it, you know, to our supervisor. Remember, we have mandatory reporting laws, right? So if a child is being abused, if an elderly person is being abused, we have to report it. If the person is an adult, in Florida, it's not mandatory to report. That person has to want to report it themselves. And if they do, then we can support them, but we cannot force them to report. However, if the person is over 18, but they have a special need, right? So they're incapacitated and they cannot make decisions for themselves because they have some sort of intellectual disability or some special need, then we do have to report that. By law, is mandatory. So those are the three that we have to report if we come into contact. Okay. Anybody have any questions? Oh, it is past 8:30. All right, so go ahead and take your dinner break and come back at 9:15.
Okay.
Okay.
Okay, guys, we are back. I sent a question in mobile attendance, so go ahead and answer that if you haven't already. All right, so now we're going to go over the case studies for each of the chapters that we just went over. So I'm going to ask everybody to participate, read, and answer some questions. So I'm going to ask Victor Gonzalez if you can read this first case study for us, please.
Okay. A home health nurse is visiting Denise Bowers, a 52 years old woman living in a subsidized housing. She is unemployed and receives health care through a medically indigent program. Is MISP founded by the county. Denise has hypertension, congestive heart failure, atrial fibrillation, and liver cirrhosis related to a history of alcoholism. The MISP program is contracting with the Home Health Agency to try to reduce emergency department utilization by patients with multi-system condition and polypharmacy. The nurse arrived at Denise's home to find that the patient has not followed through with her scheduled appointments with the congestive heart failure and Comarin clinics. Denise stated that she didn't go to the appointments because she was sick and could not ride the bus that day due to vomiting. In addition, Denise's medications are incomplete because she was unable to get a ride to the pharmacy. The nurse finds that Denise is severely hypotensive and complains of dizziness. The nurse informed the doctor that obtains order to hold the antihypertensive for a systolic blood pressure below 100. Denise would benefit from the home blood pressure monitor, but she cannot afford to buy one.
Thank you. So I want to define a couple of words that might be unfamiliar to you guys. So subsidized, right, means that a portion is paid for them. So that would be something like Section 8, right, where there's a grant, there's a certain amount of money is allocated, and basically they pay a portion of that person's rent, and then that person may only have to come up with maybe like $30 or $20 or something like that to put towards it. And then indigent. Indigent is a person who is considered to be poor or needy. So basically a person who is stricken by poverty, or even they may even be homeless. I think that was it. Okay. Thank you, Victor. So Gina, can you read and answer question number 1 for us?
Yes, sorry, my mute button doesn't work sometimes. Okay, so it says Denise Bauer exhibits a correlation between poverty and its effect on her health. Select all of the following effects that are demonstrated in her case. A, high rate of chronic illness. B, extended life expectancy. C, more complex health problems. D, high infant morbidity and mortality rates, or E, greater hospitalization and emergency visits. So I'm guessing this is a select all that apply.
Yeah, and then just think of Denise Bowers and her case. All of these could be right,
but think about her age, and some of the things that were talked about in the case study. What would
So
be affecting her?
her high rate of chronic illness.
Mhm.
I would choose that. Not an extended life expectancy. I don't think so. More complex health problems. Greater hospitalization and emergency visits.
Mhm. For sure. Right. So it's A, C, and E.
Yes.
All of those things. Extended life expectancy doesn't make any sense because we know that it's actually the opposite. We expect a shorter life expectancy. And higher infant and morbidity and mortality rates is something that could affect people in poverty, but it's not something that would typically affect a 52-year-old woman.
Yes.
Okay, but A, C, and E. Perfect. Thank you.
Okay.
All right, Yaneris, can you do number 2 for us, please?
When Denise informs the home health nurse that she did not go to her scheduled appointments, what is a cultural attitude the nurse may consider? A, this patient is non-compliant and uncooperative. B, the patient must have insufficient resources. C, the patient did not listen to instructions. Or D, the patient did not feel respected.
So first we have to think about what a cultural attitude is, right? Oh, sorry, don't look at that. A cultural attitude. So basically, how you might feel about the patient in a negative way, right? So you're making an assumption about the patient because they did not show up to the appointment. So I know you guys saw the answer. It was A, my bad. So basically, the patient is non-compliant and uncooperative. So it's important for us to, respect our patients and value them as individuals and not make assumptions. Just because she didn't show up to her appointments doesn't necessarily mean that she's a non-compliant patient. It could just be that there may be factors that or barriers that are impeding her from coming to her appointment. And that's where we as the nurse have to step in and ask questions to determine what those barriers are and how we can help the patient. All right. Shonda, can you read number 3 for us, please?
Sure. The nurse informs Denise that her doctor has ordered daily blood pressure monitoring. She informs the patient that she should obtain a portable monitor. What approach does the nurse use to assess the patient's ability to obtain a machine? Let's see. B, as in boy. Is it select all that apply?
No, it's just one.
Okay. I think, okay. B.
Right. B is the most therapeutic response, and it's the response that's gonna find out what is a barrier, if there is one, right? Basically, you're reiterating what it is that the doctor wants, right? So we're reinforcing that. The doctor would like you to monitor your blood pressure. And then secondly, we're going to find out what's the reason why she's not doing it. We're assuming here that it might be financial. So we're asking her, are you able to purchase a machine? Because we know that these things, they're not super expensive, but they're not super cheap either. So we want to make sure that that's not a barrier to her checking her blood pressure daily. The other options, so A is it's truthful. If she doesn't check her blood pressure every day, you can't say you'll definitely end up in the hospital, but it can happen. But you don't, it's kind of like you're threatening the patient, like you're trying to scare them into doing what they need to do. And that doesn't work. You have to go to the pharmacy every morning to check your blood pressure on their machine. That's not practical. If you have a patient that needs to check their blood pressure maybe once a week, maybe you can recommend them to do that. But to check your blood pressure every morning, you have to go to your pharmacy to do it. That's not going to happen. And if you don't purchase a machine, I will not be able to help you. Again, that's kind of like the first one. It doesn't really offer any kind of recourse or anything like that. You're just saying something to try to scare them. So good. Thank you, Shonda. All right, case study number 2. Iris, can you read the scenario for us, please?
Jane Giles is an occupational health nurse working in a construction setting. Her role is to conduct screenings on newly hired employees and to ensure that physicals are kept up to date. Additionally, she is responsible for delivering emergent care in the event of an illness or injury. Prevention of injuries and accidents on a construction site depends upon employees who are free of alcohol and drug dependency. Employees are aware that the nurse may conduct screenings at any time.
Good, thank you. Marina, can you read number 1, please?
Ms. Giles observes the construction worker acting more energetic and talkative than normal. He also had several near misses related to safety in the past week and was observed to be entering the site without his headgear. What would be a suspected drug that would cause this behavior? So he's acting more energetic, talkative, reckless, stimulant.
Mm-hmm. Good. So I like that you talked through it, right? And you noticed what we're looking for. Energetic, talkative. He's making mistakes. So that is the example of what a stimulant would look like. Remember that the stimulants mimic that you have more energy, but in reality, what it's doing is just causing you to expend more energy at a quicker rate than you normally would. And that's what makes you look so energetic and talkative and kind of jittery. It doesn't look normal. If he was sluggish and like not really, not really talking and just seemed down, then you would be suspicious that he was on some sort of depressant. Good, thank you. Melissa, can you read number 2 for us, please?
Yes. George approaches Miss Giles. How do you say your last name?
I would say Giles.
Okay, Giles. And informs her that he has taken a prescription opioids. He is fearful of dependence and wants advice on how to stop the medication. A reassure George that there is no chance of developing dependence. Inform George that he must stop taking the medications immediately or risk termination. Instruct George that he should gradually taper off to avoid withdrawal, and encourage George to stop the medication and replace it with another narcotic. I think C is the best option.
C, right. So A and D we can eliminate immediately because those are just wrong, right? There is absolutely a chance of becoming dependent. So A is wrong. And then D, you wouldn't encourage someone to stop one drug and replace it with another, right? Because then they could just become dependent on that one. So you're left with B and C. So when you're on the type of drug that can cause dependency, we know that we want to try to avoid withdrawal symptoms. And the best way to do that is to slowly taper yourself off of the drug until you reach to the point where you don't need to take it anymore. Thank you, Melissa. Let's see. Karen P., can you read number 3 for us, please?
What is the main purpose of implementing a substance abuse program at a construction work site? A, lower worker compensation rate for the company. B, provide a topic of health education. C, provide a mechanism of terminating problem employees. or D, harm reduction as a focus of health promotion? D?
Right. So our main goal, remember when we were talking about with drugs, in terms of how we can help people that are on it, we want to promote health, right? And we want to educate them correctly about it. So in this case, your option that you're given is health promotion. So basically that would be your correct answer. We want to reduce the chance of there being any kind of harm that can be caused as a result of them having their judgment be impaired while they're on a substance while at work. The other ones don't really make much sense. Yeah, that's the only one there that I see that adds up. All right, so we're on our last case study. So I'm gonna ask Mylin, can you read this one for us, please?
Yes, sure. Sarah Anderson is the school nurse of an educational complex serving an elementary, middle, and high school on the same campus. She is responsible for approximately 2,040 students. She has a medical assistant who helps monitors complaints with the state maintaining immunization documentation. Sarah's role is primarily related to illness, care of treatment, and the student with chronic needs. She also organizes all students and parent education related to health promotion and disease prevention.
Thank you. All right, Raz, can you read for us number one?
Ms. Anderson recently has been seeing a 12-year-old girl for complaints of vague symptoms. She comes to the office almost daily, and the nurse has noted a trend with the time of day. She appears anxious and nervous when she is deemed ready to return to class. What problem could be suspected by Ms. Anderson?
And does everybody understand what a vague symptom would be? Basically like symptoms that are not very clear. It could be anything, right? It's kind of like the flu. The flu symptoms are just kind of like, you know, muscle aches, runny nose, it could be anything.
I think it's D, that she's being bullied or pressured into the classroom.
Right, right, because you see that it's a pattern, right? So apparently there must be something going on in that particular class that occurs at that same time every day. So if she's coming in for that reason, and then when you're trying to send her back to class and she gets really nervous and anxious, then there's something that's going on. Perfect. All right, number two, Cindy, can you read that for us?
What primary prevention strategies are useful for the school nurse to use to prevent violence in the school and community? A, provide education about different forms of violence and ways to get help and intervene. B, organize a violence screening day. C, provide referrals to appropriate community organizations. And D, create support group for bullied kids. I would say A.
Primary, right? So for primary, we're going to educate. So correct. What if we were trying to do secondary? What answer would you have chosen? Anybody? No, you're good. And then what about tertiary? Which one would you choose?
C and D.
Right, because for C, even though it doesn't say for bullied kids, but if you're giving a referral for something, then it's likely something has already occurred, right? And we need to manage it. We need to manage the effects of it. And the same thing with the support group as well. Okay, good. All right, and then our last question, who have I not picked on yet? Ligia, can you read number 3 for us, please?
Yeah. Middle and high school students participate in cross-country practice each day after school. The school nurse works with the cross-country coach to provide safety education to the students. What measures are taught to the students about reducing their vulnerability to violence? Select all that apply.
Some of these we didn't talk about, but what do you think?
Um, I'm not sure about A, but maybe A. B,
Personal self-defense is good, yeah.
I think B as well, to watch out for one another.
Like a buddy system.
C, I don't think so, because it's hazardous. And then D, I'm not sure because of the stranger danger, but they could run to anybody for help. And then work with community leaders to organize crime watch programs.
Right. Yeah. So your answer is going to be A, B, and E. So C, like you said, for obvious reasons, that can get dangerous, especially when you're talking about kids. Someone's going to end up getting sprayed, that shouldn't have gotten sprayed. So we wouldn't do that. D, your text says no, because like you mentioned, stranger danger. I think like it depends on the situation. If it's a situation where you're being like potentially kidnapped or something like that, then I would run to any house that I could get to if need be. So it really depends on the situation for me. But according to the text, they wouldn't advise that. Okay. Anybody have any questions on any of the case studies that we went over? Okay. All right, so now I want to talk to you guys a little bit before you go off and do the classroom assignment. I wanted to go over with you the rubric. So give me a second, let me pull that up. The rubric for the project, hold on. I'm sorry, guys. I was talking to you that whole time on mute. Let me start over. All right, so this is the rubric here. It's broken up into 2 parts. So you got part A, where you do your introduction and you tell us about your population. And then part B is when you dive a little bit deeper and start talking about civic knowledge and engagement in terms of current events and resources that you can find in the community. So going back up to the introduction, right? What I recommend is to basically label your slides just like this. So you will put introduction. You don't have to put A, B, C, and D, just because that doesn't look too good. You don't want your PowerPoint to kind of look like an answer and questions sheet. You want it to flow seamlessly, but definitely label, introduction, cultural, psychosocial, socioeconomic concerns, specific health concerns, and so on and so forth, like that. Just be sure that you're answering. You can take up as many slides as you need to for each section, but just be sure that you're answering each part. So you want to clearly state the population. So if it's a homeless population, then you're going to write, homeless population. Then you want to describe the population. So kind of like how I defined it for you today. What does that mean? What does it mean to be homeless? Then talk to us about some demographics. What are the numbers that are out there in the United States? And you can even break it down as to South Florida, since that's where we're living. And it would be really good for you to have that information as a nurse working in South Florida. Talk about the background of the problem. How does this become an issue? So on and so forth. So then you move on to the cultural, psychosocial, and socioeconomic concerns. And then you want to talk about those, break it down into each level. Specific health concerns. We want to talk about basically concerns that target specifically that population. The role of the public health nurse. So you want to talk about what is our role as public health nurses in caring for this vulnerable population. Talk about the core functions. Remember your core functions, guys, is going to be assessment, policy development, and assurance, and how that applies to that specific population. Here, we're going to talk about 3 local agencies, facilities delivering services. So that's kind of what you did today, where you identified those resources in the community. And you're going to describe, identify them and describe what the services are and how they help them. All right, your civic knowledge and engagement. So this is where you're going to find a current event that's happening in the vulnerable population, right? So maybe this is something that's something happened in the news, in the media, something that's going on. It's a current event, but it doesn't have to be like 2020 or 2019. It can be a few years back, as far back as you need to go to find something that's relevant. Okay, and then you're going to talk about the event, what happened, what are your thoughts on the event, what can be done to address it. All right, and then this is just talking about your presentation and the organization of your PowerPoint. So you'll be graded on that as well. So just be sure to keep in mind your presentation, have your camera on, be clear, and also have your PowerPoint organized in a clear manner as well. Okay. Anybody have any questions on that? So, yeah, just upload the same exact thing so that I have something to grade, because I can't put a grade in if there's nothing there. So yeah, just refer to this. You can find this on Blackboard under assignments, and I also posted it on Doc Sharing. So as long as you follow that to the T, you guys should do well on that assignment and get your full points. All right, so now it is 9:48. Go ahead and get your class assignments and go ahead and start working on that. You do have a lot of questions this week as well. I'm sorry, but it will help you with your exam. So go ahead and work on that. And if you have any questions about it while you're working on it, feel free to ask me.
Professor, for the cultural self-assessment tool, it has to be handwritten?
No, you can type that one.
Okay, and then when it says cultural terms, do we have to define the terms, or that is for, no? Okay.
Yeah, you don't have to, but be familiar with them, because in week 5, we're going to talk about that in chapter 5. And there are definitions that are going to come up on the exam. So be familiar with them, but I'm not going to make you write them out.
Okay, thank you.
You're welcome.